When your child is struggling with PANS and PANDAS, the question of medication can feel overwhelming. Hi, I'm Dr. Roseann, and I make calming dysregulation easy. And today we're going to talk about should I give psychiatric medication to my child with PANS and PANDAS who is struggling with psychiatric symptoms? We're going to get into the research and talk about pros and cons and when it's not appropriate. And of course, what are alternatives to psychiatric medication? First of all, psych meds are often prescribed, well, they're given out like Skittles nowadays, but psych meds in the case of PANS and PANDAS are used for more extreme symptoms, right? So high levels of OCD where it's unrelenting, where it's really eclipsing their life, anxiety, high levels of aggression, and of course, psychosis. And, whenever psychosis or aggression is there, please look at tick-borne illness, particularly Bartonella and Babesia. They are highly linked in the literature to anxiety, more of those higher level clinical conditions. And, testing is testing and it doesn't always show up because of the invasiveness of the tick-borne illness, and it hides inside the cells, and it's kind of hard. So what are common psychiatric medications that are given? So one, we have antidepressants, which are SSRIs, and they impact serotonin in the brain. We also use antipsychotics, and in some cases they're using ADD meds, psychostimulants. Please, oh yeah, big mistake. And what I want to say about psychiatric medications is they treat symptoms, not root causes. In general, but specific to PANS and PANDAS. So we know there's an infection and toxic trigger. We really want to look at what is the origin of this PANS and PANDAS, because these psychiatric symptoms and cognitive symptoms are only there because of a misdirected immune response that leads to a lot of neuroinflammation, right? So before you medicate, let's talk about the side effects and what the research tells us about medicating with PANS and PANDAS. There's very limited research. It's a lot of anecdotal information, but there was a study in 2021. They talked about the most common reasons for medicating kids with PANS and what were the side effects. So one, we already talked about OCD, anxiety, and aggression, three most common reasons. You're not going to medicate away OCD, by the way, right? If it's PANS and PANDAS, we know that we have to address the infections and toxins. But once OCD shows up, it forms a habit in the brain. It's called a negative reinforcement cycle. And because a person does a ritual, a mental or an actual physical ritual, a lot of OCD is actually internal. So we don't know what the rituals are until you work with a great therapist. But that ritual gives a little relief. And so what happens is, because they're getting a little relief, the behavior is much more likely to get repeated over and over. Now, when the OCD is happening, they get the relief, right? They have a spiking of anxiety, distress, whatever you want to call it. And then they perform their ritual. And so then it goes down, but it doesn't go back to baseline. It actually, baseline keeps moving it up. That's why it's called a negative reinforcement cycle. The more the person does the behavior, the more entrenched it becomes in their behavioral habituation, and it just happens on autopilot. And actually what happens a lot in OCD, well, always happens in OCD, is that the people around you inadvertently, accidentally accommodate it. They feed the OCD. So it's really important with OCD in PANS and PANDAS to recognize that it's a behavioral habituation of the brain. And even when you medically treat it, forget about psychiatric meds, when you medically treat it, it's not likely it's going to go away on its own because you have a behavioral habit. You want a good ERP therapist. So in this study, 54% of people had significant side effects, even at low dose of these medications. So let's talk about the medication side effects, right? So in this study, they didn't look at ADD meds. I'm just going to tell you anecdotally that I see sometimes the ADD meds actually as the trigger for more severe behaviors before somebody even knows that it's PANS and PANDAS. I've had multiple people have psychosis from ADD meds. The literature does show that it's possible, but in PANS, PANDAS, it can just cause that activation, of course, from the nervous system. It's a psychostimulant, and just push somebody over into that agitated state and can have a lot of different kinds of negative behaviors. Always be careful. Medication, psychostimulants really are very common, and they're commonly given out because there's an incorrect belief that there's not harmful, but there's 100% of the time a side effect that could be mild, like sleep problems, but also severe. So know the facts. Okay, so SSRIs, what are the most common side effects? Anxiety, agitation, aggression, movement issues. It can create uncontrollable movements. Those in the study were the most common, right? And then antipsychotic, you have dystonia, which is involuntary muscle contractions. It's very scary when you see it. That can happen with, antipsychotics. That can happen in other people, not just PANS and PANDAS. Aggression, self-injurious behaviors, behavioral movement abnormalities, and just behavioral agitation in general. So again, even with lower doses, this occurred. And I want to say the FDA has a black box warning on SSRIs saying that it can worsen psychiatric symptoms, including leading to rage and suicidal ideation. So it's a big deal. In the UK, they actually have an even more severe warning on it and say that it's not, there's no clinical research shown for psychiatric medications for youth. So they just think differently in Europe. I appreciate them. So I'm not opposed to medication. You just need to understand the facts. The pros, it can bring relief, short-term relief in some cases when things are completely out of control. And know that infections and toxins can unlock epigenetic potentials, right? So we all have these genetic variants, and we have things within our epigenetics that might not have been awoken. And, injuries, trauma, infections, and toxins can bring these things out. And so it is possible that you have the infections and toxins and a secondary issue just occurring simultaneously. With that being said, when people get proper treatment, medical treatment for the underlying infections, the toxins, time and time again, we see people resolve their symptoms. I do when people, work with me. And so I want you to stay hopeful and understand this really is a short-term solution. It's not going to fully address the PANS and PANDAS, right? It's only addressing that one symptom. Cons. So high risk of side effects is the greatest con, and actually a destabilization. I mean, that's what I see more than anything. And of course, as I said, it doesn't address the root cause. And, as I said, also the destabilization, that potential for worsening symptoms isn't just about seeing the symptoms get worse. It's about how scary that is, how scary it is for you, how scary it is for your child, how much it dampens your hope. And so we hang our hat and we think the magic wand of these psychiatric medications in general for complex issues. But in PANS, PANDAS, again, it is not addressing the root cause, and a lot of people will tell you that. So what are alternatives to medication, right? So number one, obviously, you got to focus on the root cause. You got to find a properly trained medical provider who's going to address the infections, the inflammation, right? Listen to the video of the 5-pronged approach. We must reduce that inflammation, and you can do that in a variety of ways: diet, exercise, nervous system regulation. But you also really need to get the detoxification pathways. We need to open up our detoxification pathways, get drainage going. We need to get the actual toxins out and their waste products. Otherwise, you're stuck in an inflammatory brain profile. And it's the inflammation, the neuroinflammation, that keeps the PANS, PANDAS symptoms in a flare cycle, right? And so, again, I can say it 100 times. I don't believe you have to constantly be in a flare cycle. You've got to do other things to get out of that. And incomplete treatment, improper treatment, not living the lifestyle are definite factors in that. So, what else can we do? So, improving the diet, thinking about what are those things that really throw fuel on this fire. What are foods that could really help me lower that inflammation? A Mediterranean diet, an anti-inflammatory diet. Your kid loves berries, give them berries. That you can sneak smoothies in. These are all anti-inflammatory foods that have high density nutrients in them. And boy, do you need a lot of nutrients. So, what else can you do? So, obviously, in our one-to-one program, we do neurofeedback. We use our CALM PEMF device, brain tools. Sometimes the nervous system is so dysregulated, you just need to go and do these types of things. So I talk a lot about nervous system regulation. And when you are practicing these things daily, you are better off in life in general. But what these tools do is they provide quick relief that you have to use continually or the prescribed amount in order to create long-term relief. So there's this misnomer that, things like dietary changes, neurofeedback aren't quick. Well, they actually are really quick. It's just that if you aren't following the prescribed amount of neurofeedback sessions or staying on the diet, you are not going to get the nervous system regulation changes, the lasting changes that you need. So sticking with things that are working is important. And I know that sounds really silly, but I see that happening so much because we are an impatient world. Patience is not my virtue. Okay, OCD, one of the best solutions for OCD, obviously, besides the things that we're talking about, is what I mentioned earlier. Exposure and response prevention, ERP, is the gold standard for behavioral therapy for OCD. You're kind of wasting your time with other therapies. Please don't go to an anxiety specialist. You really need a specialist in OCD. If you're not working with my team, you can go to iocdf.org. You can go to Anxiety and Depression Association of America, and you can put in the words PANS, PANDAS, OCD, and find somebody, because you're kind of wasting your time with providers that don't have that expertise in those areas. They're just going to send you in the wrong direction. They don't get it. I don't know how they don't get it. And here's the great news. There's a lot more therapists who are literate and aware because they have to be, right? My biggest tip is to work with a literate specialist. And I do understand that they're not everywhere, which is why so many people hop on a plane and come to see me and then work remotely with me for the remainder. You can go to www.drroseann.com/help if you want to do that. What else can you do? So here are things that everyone wants to know, like, why do my people get better? Because they do. And it's things that people aren't talking about. So one, they focus on co-regulating. We teach a lot of co-regulation skills because you are so overwhelmed. You are so distressed. I've been there. You think this is a sprint, but it's a marathon. And so you need to put your oxygen mask on. And co-regulation is really important. You need to do things like pray. Religion and belief is a very powerful thing. I don't care which one you are using or practicing, but it is a definer in the success of people that I work with because this is so overwhelming. It doesn't matter what's going on with your kid. Religion brings you hope and it gives you higher power authority. And I just see it as such a powerful thing in some of the most difficult cases I have. They have just very different outcomes. So I think that's important. You need to regulate your nervous system. You need to regulate your child's nervous system, and nervous system regulation is an unlocker of healing. So regulate the nervous system before you medicate. I mean, I can't say that enough. There are so many ways to do it. You can follow me. You can learn more. You can go to drroseann.com/help, get matched to the right solution. I hope this was inspirational for you. I hope this gave you an understanding and got you thinking about the onset and the triggers, because when you do, you can get to solutions.